perform perineal care on my patients. First things I'm going to do, I'm going to start with hand hygiene. For hand hygiene, the next thing I'm going to do, I'm going to wear my PPE. I'm going to put it on my neck. Okay. And I'm going to go around, put my hands in between my garments, and I'm just going to ensure that. Okay. The next thing that I'm going to do is I'm going to put on my face shield. I'm going to put on my mask. Sorry, I'm going to put my mask this way. And I'm going to put on my gloves. Just make sure my hands on the I'm just going to take the other glove from the cuff, the other layer. I'm just going to put it in here from glove to glove. Okay, next thing I'm going to do, this is my patient's room door. So I'm going to knock into my patient's room. I'm going to enter, and I'm going to ask my patients for the full name. Hi, my name is Nurse Jeremiah. I'm going to be your registered nurse for today. Can I get your full name and date of birth? Okay, I'm going to ensure patient privacy. Okay, so I'm going to be performing perineal care on you today. Do I have your consent for this? Do I have your consent? Yes? Okay. Also, you're currently in isolation to take necessary precaution. Do you have any questions for me? No? Okay. Do you feel any pain or discomfort? No? Okay, so I'm going to go ahead and I'm just going to adjust the bed to working position. Now the bed is in working position. Next I'm going to do, I'm going to position my patient in dorsal recumbent position. Before I do that, I'm just going to get my supplies in the room. Okay, so I'm going to position my patient in dorsal recumbent. The next thing that I'm going to do is I'm going to cover my patient just for their dignity and their privacy. Okay, next thing I'm going to do, I'm going to place my blue pad underneath the patient. Sure. Okay, next after that, I am going to perform a physical assessment on my patient just to see if there's any redness, pain, or swelling. So I'm gonna see. So far, I see no redness, no pain, no swelling. I'm going to ask my patient, do you have any discomfort? Do you feel any discomfort? My patient says she has no discomfort. Would you need any assistance doing perineal care today? Yes. So I'm just gonna go ahead and I'm gonna get my supplies here. I'm just going to have my basin with water, and I'm going to wet my cloth with the solution, rinse it, and I'm going to clean the labia, the outside of the labia on both sides, from front to back. Okay.
5 minutes remaining.
I'm going to clean the sides of the labia front to back. The other side, front to back. Okay, I'm going to do the labia majora, front to back. So I'm doing the labia majora, front to back. And the other side, I'm cleaning the sides of my labia majora, front to back. The other side, of my labia majora. Okay, and I'm gonna dispose this. I'm gonna get a clean cloth. I'm going to dip it in my solution. Do the labia minora. Sides, the sides. Get a. Gonna change the new clean with the new clean cloth the size of my labia minora. Okay, dispose this. And next thing I'm going to do, is I'm just going to clean the center of my of the patient with the solution. Okay, now that's done. I'm just gonna get a new one, and I'm gonna rinse my patient. Do the same thing like I did before. I'm just going to clean it with side to side, labia majora on the other side, and labia majora on the other side with both a clean cloth with water. Okay. 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 And I'm gonna do the labia minora, the same position. Front to back, front to back. And then I'm gonna dispose this. Next I'm gonna do is I'm gonna pat and dry. Pat and dry. Other side. Pat and dry. Okay. Once that's done, the next thing that I'm going to do is I'm gonna clean the catheter around with my solution. I'm gonna use my non-dominant hand. I'm just going to raise the catheter. Oops. Just gonna clean around the catheter with my solution while holding with my non-dominant hand. And then take another side. I'm going to raise the catheter and I'm just going to clean 4 inches upwards. Okay. Now once that's done, I'm just going to dispose all my supplies all to the side. Okay. So next what I'm going to do, I'm just going to take my cloth off my patient. And I'm going to put my patient back into regular position just to ensure their privacy. Taking care. Okay. So once that's done, I'm going to adjust my bed back down. Okay. And once that's done, I'm going to take off my PPE. I'm going to take off my PPE. First things I'm going to do first, I'm going to take off my gloves, glove to glove with the cuff. Then with my other hand, put it inside, skin to skin, take off my glove. My glove is done. The next thing I'm going to do is perform hand hygiene. Take off my PPE. I'm going to put my fingers in between my PPE and I'm going to roll it inwards.
2 minutes left.
Okay, and then I'm going to perform hand hygiene. And I'm going to take off my face shield, my face mask, perform hand hygiene, and I'm just going to come out of my patient's room. And that is how you perform perineal care on your patient.